Hello, and welcome to Psychopathology. I want to give you some guidance on your assignments and your quizzes and final exam. Sorry, I can't see without my glasses, and it would appear there's quite a bit of light that's coming through the window. So I apologize for the light. First, you need the full DSM-5 TR manual. You can do a ebook, or you can do the hard copy book. I tend to like ebooks because I'm not a fan of all of the paper and the physical space that regular books take up. But if you are going to do any clinical work, you will absolutely use this again. You'll use it regularly. And for this course, you're going to be required to consider differential diagnoses and context of the individual, potential cultural factors, environmental factors, discrimination, oppressive, misogyny type, sexism factors. And the full DSM provides details that need to be considered for every single disorder that you can clinically diagnose someone with. So you need the full book. Second, how do you find the information that you need? I'm going to share my screen real quick, and I will give you an example. Don't judge me for my desktop. A lot of stuff here. You can see here, because I'm getting ready to lecture on ODD, the first thing you see is the diagnostic criteria that breaks everything down. So for example, in this one, it gives you the explanation at the top. You need at least 6 months of at least 4 of these 8 symptoms. So 4 of these symptoms for 6 months during an interaction with an individual who is not a sibling. So they do consider what it was like to grow up with a sibling, have one myself. So I can understand that. And then it gives you specifiers, if there are specifiers for the specific disorder. For example, for ODD, it's based on the number of settings that the defiant or oppositional behavior emerges in. So for example, mild, it would only be 1 setting. Moderate, it would be present in at least 2 settings. Severe, it would be present in 3 or more settings, like home, school, after school program like daycare, out in the community with friends, things like that. You would need to pay attention to that and then note what the severity is. Gives you a little more detail about diagnostic features, and then talks a little bit about the developmental course, so things to consider of what potentially is coming down the road for these individuals. And that's important when you are trying to identify risks for future need, as well as when you're thinking about your intervention approach. What is it that you're going to focus on? And then here we are, cultural related diagnostic issues, sex and gender related issues. And then here, which you're absolutely going to need for your case studies that you have to conduct, is a list of differential diagnoses. So once you identify a diagnosis that you believe a client meets criteria for, you want to consider the other potential disorders, and you need to rule them out. You need to check them and make sure that the client does not meet diagnostic criteria for those disorders. If we do not check differential diagnoses, what happens is our natural confirmation bias takes over, and we are more likely to misdiagnose someone than we are to accurately diagnose them. think of it as, instead of trying to prove yourself right, you're working to see if you can prove yourself wrong. And in doing so, you are confirming if this is the accurate diagnosis or not, right? So full DSM, and when you pull up each of the disorders that you believe, this is what I think my client has, you want to look at some of the other cultural, environmental influences, individual influences like sex, gender identity, and then look at the trajectory. What are the potential risks of having this disorder? And the reason that's important is because, one, most people will think, well, if I give someone a diagnosis, I'm obviously going to treat what that issue is. You will find often that your clients or patients will have more than one thing that needs to be addressed, especially for children with, let's say, for example, ODD. They're going to have multiple issues. They're going to have academic issues. They're going to have social functioning issues. They're going to have interpersonal relationship issues happening in the family. And as a clinician, it is your job to essentially identify the hierarchy of importance of what you're going to work on. One, because it's not always feasible to work on everything at the same time. Okay. Two, sometimes you have to fix one problem in order to work on another one. And three, it can be overwhelming for clients and patients. I'm going to use those terms kind of synonymously. It can be overwhelming for them to have too much that needs to be done all at once, especially if they're a child, or an adolescent, or an adult who's in significant distress, right? So looking at the differential diagnoses, ruling them out, and then identifying what are the potential risks long-term, what's like the developmental trajectory of this, will help you get a better idea of what has potential to do the most damage the longer that my client or patient has to deal with it. So that if you do have to figure out, okay, I can't deal with all of these at the same time for these reasons, and you use your clinical judgment for that, okay, based on your understanding of the client, their level of functioning, and their capacity, right? Then you say, okay, this one has potential to do the most damage. That's likely going to be the one I'm going to need to address first. Okay. Now, be mindful of this. Obviously, if there are issues in the home and it is creating a great deal of stress and dysfunction in the family unit, that might need to take precedence over something else that you're going, this could create a developmental issue long-term, because the stress in the family unit can create more catastrophic consequences, right? And again, this is where you're going to have to use your clinical judgment. So you're going to need to think about, okay, here are the issues. Here's the potential outcome of these issues. What can I start to address right now? What do I need to, if necessary, wait on? And if I need to wait on things and I can't do them all, what absolutely needs to be the first thing that I address? And how do I work towards that? And this will help you identify the interventions appropriate for your client. Because, for example, since we were just doing ODD, I'll continue with that. For oppositional defiant disorder, let's say that you decide to work on the family unit. You're likely going to use interventions that focus on parenting strategies, coping strategies for the child, environmental modifications like changes in structure, expectations, things like that, consequences. There are numerous things. Whereas if you were to focus solely on oppositional defiant disorder, it might be a universal strategy of, okay, these are the things that we need to do to shore up greater compliance. greater self-esteem, a more interconnected social relationship. Because for every destination that you want to go to with your client, think about their outcome. I want you to think about interventions like GPS. I use Waze. I don't know what you all use. Waze is one of my favorites. When I select a destination I want to go to, Waze will give me usually 3 different options of how to get there. You have way more than that, okay? There are numerous interventions, and they all are intended to get you to specific destinations, but several interventions will overlap. You will never find one intervention that is 100% of the time applicable to 100% of your clients. You are going to need to be flexible because you have to consider the ability and capacity of your client. How much stress can they endure? What is their cognitive functioning and understanding? What is their communication skill, their social functioning, and so forth? You're going to have to consider the context of their environment. Can I do something with a child if parents completely disagree with it? There are a lot of things that you will face where you're going to go, okay, think of it like traveling from point A to point B. There's construction over here. This road is closed, but these 2 pathways are still left open. This one's going to take this amount of time, and I have to take this path. This one's going to take this amount of time, and I have to take this path. I think the preference is this path. While simultaneously getting buy-in from your client, right? Because we always want to reinforce self-determination. And that means telling them what the options are, and asking them, what do you think, just at first glance, sounds like the best fit for you, right? And this is how we maximize treatment outcomes. We are not to pull our client along by the nose or the ear to get them to do what we say needs to be done simply because we know that it will work. No intervention is that fantastic, okay? So use the DSM for more than just the diagnostic codes. A lot of research has gone into really clarifying the information that you need as a client to not only think about them where they are right now, but where they might be over a period of years, and what those consequences look like. And that will allow you to create a hierarchy to prioritize what needs to be addressed absolutely first, what can be, put off a little bit later, and so forth, right? So use the whole book. It's really helpful. It helps reduce your confirmation bias as a clinician. And I know we all want to believe that we don't have confirmation bias, but your brain naturally does that. Your brain is constantly trying to solve problems before they arise, and it's trying to do it in the shortest time frame possible. And as such, it's easier for your brain to attempt to fill in gaps, to find what it already knows. And it requires metacognition, quite a bit of it. It's counterintuitive for us to spend more time on this and to go, instead of proving that I'm right, let me see if I can prove myself wrong. Okay, so the book will help you walk through all of that for each specific diagnosis with the information that is relevant. So it's absolutely critical. If you have any questions or you need any assistance in working your way through the DSM and really understanding what that information means and how to interpret that as a mental health clinician, don't hesitate to reach out to me. Okay, I'm happy to do a one-on-one and talk through it with you. All right, thank you for listening. and you're going to see me in a lot more lectures. Have a good day.